Sports Medicine Institute, taking care of my elbow, getting my wife on the right path for her marathon, and making sure I keep a clear head about me. Dr. Kevin Crutchfield is here. He is a concussion specialist. He is over there at Foundry Row in Owings Mills, joining me every other week, along with Dr. Craig Bennett, who will be joining us next week about all things orthopedics. You know, Doc, you and I have talked so much about football, right? And so much about soccer and girls' heads and children and parents being worried about all this stuff. Here we are in spring and it's lacrosse season, and we could talk about no one going to Orioles games, but everyone around here plays lacrosse. And the boys and girls games, certainly at the youth level, very different games, right? From a contact level and what we want to see. And the men's game's all about strength and speed and all that. Concussion and lacrosse. Don't talk about that. Not a lot of movies made about that yet, right?
Well, hopefully they don't make a movie about it. I was grossly disappointed about the movie about football, but that's a whole other topic. Concussion is an issue. The reason the men's game evolved wearing helmets was because of the number of head injuries, not from head-to-head contact or head or body-to-body contact. It was the ball and stick striking the head causing the injuries. So the men's lacrosse helmet is designed for protecting hits from the other player's stick and the ball at the speed at which the ball travels. It is not intended to be a helmet-to-helmet protection device like the football helmet.
And is that something that I would think everybody in the lacrosse community would be concerned about? Or would we say we played a lot of lacrosse and nobody's died yet or whatever? Maybe somebody has. I don't know. But certainly the publicity around football and football helmets, we don't really – and soccer and heading the ball, those are the two – look, MMA is a whole different world, right? Boxing, that's a whole. We'll do 10 topics on that and 10 different pieces on that. But for lacrosse and here and now, what kind of helmets do they use? You and I have talked about bikes and biking, and and the risks of driving around behind buses in the city when you're on a bike without a helmet. Lacrosse and injuries. What do you know about that? I would think you've been here in Baltimore long enough to know that some kids have definitely come in getting hit with a head on a stick, right?
Well, I was born in Baltimore, so I've been here for a while. It's a collision sport. It is designed in the rules of the game to hit the other player, but you're not taught to hit leading with your head. Lacrosse is a game where you pick your arms up and you cross-check as you're going into the head. So the majority of the worst head injuries I've seen in men's lacrosse is a cross-check across the head, which is supposed to be illegal. And the worst offense comes when one player's going down for a ground ball, so they're stooped over, and the other guy just lays into him with the stick. They need to protect the guy going for the ball and the ground ball a little bit better, maybe with some subtle rule changes, would reduce the number of the more serious concussions in the game. You're still going to get a hard shot to the helmet that can rattle a kid's head. I mean, that ball is moving. Back in the day when I was an athletic trainer in college, the mask on the goalkeeper wasn't as narrow, and I remember our starting goalkeeper, starting attackman for University of Maryland, did one of those underhand cannon shots, hit the mask, the ball actually squeezed through the cage and broke the goalie's nose.
Wow.
I mean, that's how hard they shoot that ball.
Well, I would think over the course of time, the balls have gotten harder, the cages around. I would think all of this equipment at this point, 40 years later, would be, extraordinary, but I don't know. I've never had lacrosse people talk equipment with me. I've had football people talk equipment with me all the time.
To my knowledge, the ball has not changed.
Okay.
I think the lacrosse ball today is the same as it's always been.
Okay, fair enough.
Well, I kind of personally know that because I juggle, and the best thing to juggle are lacrosse balls. And they haven't changed.
Fair enough. Well, that's good to know. Then I thought they would be using something different at this point than they used in 1972. But baseballs, every year they feel the change. Dr. Kevin Crutchfield is here. He is LifeBridge Health Sports Medicine Institute there at Foundry Row in Owings Mills, doing all things, not just concussion, but anything that's good for you. My wife's trying to get out and do a half marathon, and the docs out there have worked with my wife after 2 cancer diagnoses, and certainly we'll have Dr. Craig Bennett on next week as well. For you with the draft and all this stuff that we hear about over the week here during an NFL draft, and I know you're an NFL fan, and deep down we've all thought about this and talked about this. You work on it every day of your life as a concussion specialist, but when you start to see the football stuff this weekend, is it interesting to you that maybe the conversation steers away from all of this?
No, I mean, I kind of watch because I'm interested, but I'm not invested in it,
Sure.
per se. You know, I mean, in a couple of weeks we do rookie physicals coming up, so I'm interested to see who's picked and, you know, who I'm going to be doing an exam on in a couple of weeks from that perspective. And, you know, I kind of get to know the guys a little bit. I have to. You know, I want to know when they're injured. You know, but I'm not in there every day. So I'm the guy they see. I see them preseason, so I know how their nervous system functions. I document what we find, and when they get injured, they come in and we do a comparison, you know, because a lot of these guys have been playing contact football since they were 8 or 9. So, you know, the question for me is what's new and what's old? You know, you can have some residual stuff that I need to know about that I'm not holding you out from your career based on an abnormal finding that may have been there for a while.
Well, I would think for all these teams, when they put their medicals together here, where is the baseline for anyone? It's the first time they've really been examined, and then maybe they haven't even been examined as well as you would like them to have been examined when they were 14, 16, 18, whatever that number is, where they had some sort of a baseline to know where they started from, right? So when you pick anybody up at the age of 21, 22, 23 to say, okay, the kid had a concussion sophomore year of high school and another one freshman year of college, how would that show up in detail when a guy like you finds them at 22 coming out of Purdue and you're examining them for the first time?
Well, I'll be very clear. I'm a neurologist. We're the only group of physicians that have actually been certified to do a detailed neurologic exam. Other specialties do a neurologic exam, but it's actually part of our board certification, or was. They recently changed it, much to my chagrin, where we actually have to examine 3 patients in front of senior neurologists so they can actually observe that we know how to take a detailed history and do a very detailed neurologic exam, but that's what we do. I mean, my specialty has been doing this before MRI scans were invented, so we could help doctors figure out where the problem was in the nervous system based on the exam, and I still practice that way. So I know where the problem is before I order a scan, so I know where to go looking. So I do a very detailed exam, and I spent 2 years at the NIH in a rare disorders section basically cataloging every neurologic abnormality in these rare diseases so we could figure out where in the nervous system the problem was and develop treatments. And I'm very proud to say that 2 of the diseases that we treated had no treatments when I got there. And by the time I left, we were on the road to actual bona fide treatments for these diseases. So, you know, understanding how the nervous system works, figuring out where the problem resides, and what can we do to intervene and treat it is the hallmark of what neurologists do. So we do the exam. You know, a lot of people do neurologic exams, and they do wonderful screening exams, but they cannot say they do the same detailed exam that I do. So I'm going to find stuff, and I'm not going to give numbers because I don't think that's part of the conversation. But they're not all 100% normal, but these athletes are so gifted, they have learned athletically how to compensate for these subtle deficits. But the flip side is, we can fix some of those subtle deficits, and if we fix them, they don't have to bleed athleticism to compensate for an abnormality. They can, if we fix the abnormality, they can now focus the athleticism on performing the sport. And we've been able to do that time and time again by incorporating some basic neurologic rehabilitation stuff into their daily workouts to start working on fixing the nervous system and get it to function better, so they can perform better as an athlete.
Dr. Kevin Crutchfield, I'm sorry, go ahead, finish up for me.
I was going to say, we've kind of talked about this, you know, and you don't think about baseball and concussions, but a concussion in baseball can be literally catastrophic, even if it's minor, because, you know, football is a game of inches. Baseball is a game of fractions of inches. So if you're dealing with a little bit of imbalance still from that concussion, and you step forward to hit the ball, and you're slightly off, and your body has to now subconsciously compensate for that balance, you're not going to put the barrel on the ball when it comes over the plate.
Doc, it'd be interesting you would say that to me because this week we're hearing Brian Roberts call games, for the Orioles. For those of us who are watching the Orioles, the handful of us left here in April, it's incredible. But Brian Roberts calling games, and when I think of him, I think of this guy that had gotten knee to the head, right? I mean, early, and then had recurring symptoms, and I don't know that the fans really understood it, and you'd have to have had these symptoms and how it makes you feel and all of the associated darkness, light, nausea, a lot of the stuff that I saw my wife go through with her cancer to understand how difficult it is to function at any level, let alone play baseball when that's happened to you,
Yeah. I'm not going to talk about Brian specifically, but my experience with athletes that have lingering symptoms following a quote-unquote concussion is almost invariably there is something else going on. And because we've raised so much awareness about this entity called concussion, that we now get laser focused on that diagnosis, and we forget to examine the rest of the patient and find out if the problems, symptoms, and even subtle deficits in function can be coming from a different part of the body. And that's what we're finding out, at least in our program, is we get everyone's failures for the most part. We get people that just aren't getting better from their concussion. We get a few, early run-of-the-mill concussions, and I'm grateful for those, but we really are the problem solvers. So it's usually something else. And this came up in the National Sports Medicine meeting I went to last weekend, not this past weekend, but the weekend before, and another neurologist who does what I do, we sort of had this conversation, and we came to the feeling that it takes a brain injury expert nowadays to understand when it's not a brain injury.
Wow.
Because the symptoms overlap, and everyone's really good at screening symptoms and categorizing people as possible concussion, but they're forgetting to be specific and diagnostic. And it takes a brain injury expert to come in and say, this ain't the brain. The brain is doing what it's being told to do. This is something different.
Dr. Kevin Crutchfield is here. He's at LifeBridge Health Sports Medicine Institute. Anybody can reach to him. He's at Foundry Row doing this kind of work and trying to teach me things here. I appreciate that, Doc.
Sure, no problem.
Well, it's not hard when the baseline is where it is with me. Hey.
Well, I'm at the part of my career, and I said this to Craig Bennett yesterday. I said, I'm tired of making noise and trying to raise the roof, because when you raise the roof, you leave everyone else on the floor and leave them behind, and that's not helping anyone. My goal now is to educate everyone and raise the floor. Let's raise the baseline up. Because when you raise the floor, Nestor, everybody stands taller.
Appreciate that, man. That's a great spring wisdom for us headed into draft weekend. We'll catch up with you a couple weeks from now. Always great to share your wisdom and have you aboard.
Hey, no problem. I always love talking to you.
Dr. Kevin Crutchfield. He is the concussion specialist at LifeBridge Health Sports Medicine Institute. I came on for a lacrosse conversation. We wound up talking about baseball and all that stuff. And certainly, it is good to hear Brian Roberts back on the air as well when he's on. But I always think of him and his career being altered, literally right in front of our very eyes, by a concussion. And we talk so much about concussion in football. There's your concussion in baseball story that really changed things. So good to have him back. Good to hear him talking some baseball. And good to hear some candor from Brian Roberts as well. Nasty at WNST.net finds me. I'm out in the buyatoyota.com audio vault 24 hours a day from anywhere in the world on your mobile device by downloading the TuneIn Radio app. We do come in crystal clear from anywhere in the world. Our morning newspaper ships digitally to your email inbox. That's all brought to you by Planet Fitness and PlanetFitness.com. Always $5 down, $10 a month to get in the best shape of your life. Also brought to you by the Maryland Jockey Club. Yes, the Kentucky Derby's next Saturday, and they are having a hootenanny. Big party down at Laurel. Wear your hat. Bring your wife. That's what I'm planning on doing. Bet the ponies. Have a great day down there. That sports book's fantastic down there. Get on down there and see the big wall. Probably get a hockey game on as well. Some horse racing. Beautiful day of racing. Kentucky Derby Saturday in the Mint Juleps. Nasty at WNST.net finds me. I am on Facebook and Twitter and LinkedIn and Snapchat and Instagram and streaming live on our YouTube and our WNS TV channel wearing my LifeBridge Health Sports Medicine Institute hat. Appreciate the good doc coming on. We are WNST.net, AM 1570, and WNST, Towson, Baltimore. We never stop talking Baltimore sports.